Wonderful edition of Ask Your Pharmacist. Then again, you have to know that this show is brought to you by Dragnet, your #1 online pharmacy. You can go ahead, download the Dragnet app on Google Play Store, the App Store, order all your medications and have it delivered to you at a cool price. And this is also brought to you by the Pharmaceutical Society of Ghana, supported by Samus Pharma Limited and ETV Ghana. So today we are at Accra Mall. After this break, I would introduce my guest pharmacist and the topic for the day. Stay tuned. Don't go away. I'll be right back.
Are you tired of roaming for your medications and can't find them? Sick and alone and can't get anyone to get your drugs? Do you need to talk to a pharmacist? Or do you feel uncomfortable when buying certain drugs from the pharmacy? Do you want your drugs to be delivered to you at the comfort of your own home or office? Then it's time to download the Drugnet app, spelled DRUGNET, from the Play Store or the App Store to enjoy total convenience. Use Drugnet, your #1 online pharmacy. For further inquiries on Drugnet, call 024 00 24455.
Welcome back to Ask Your Pharmacist, and today we are at Accra Mall. Our guest pharmacist today is Pharmacist Mariam Apreku. She is a superintendent pharmacist at Palza Pharmacy, and today the topic we'll be talking about is contraceptives. Fam, how are you doing?
I'm great.
So what is your take on contraceptives? How are you going to take this up?
So today we really want to engage the ladies around here, especially the ladies, because I want to concentrate more on the hormonal contraceptives, the pills especially. So I want to engage their mind to know how often they even take it, do they even know what it contains, and also give them a few tips of how to even choose any contraceptive at all. So that's what we are doing today.
Alrighty, there you have it. So Fam will take it right away.
Mariam, I'm a pharmacist. So today I'm here talking about contraceptives. So I want you to tell me any little thing that you know about contraceptive.
I know that it's to prevent unwanted pregnancies. Yes, that's what I know about.
That's all you know about contraceptive. Oh, that's a fair idea. Okay, so I want you to ask me one question about contraceptive.
Okay, I want to know the side effects of taking contraceptives regularly.
And how regular you need to take them, right? Okay. So sometimes, depending on the kind of contraceptive you are taking, especially the pills that are meant for women, usually they are hormonal in nature, and sometimes not just the pills, the injectables, the ones they put in the arm, they will give you side effects because they are hormonal in nature. Okay, so sometimes some women will find themselves gaining weight. Remember, it's not all women, and some women will find themselves bleeding in between. Thankfully, some of these symptoms will resolve, but sometimes some they don't. So if it doesn't, you need to see your midwife, you need to see your doctor, and you change it. And about how regular, it depends on the kind of contraceptive you are taking. So imagine you are taking an emergency contraceptive every time you are having sex. That is a no-no. You are supposed to take an emergency contraceptive when you are not safe. So a maximum of 2 a month is what you actually really need as an emergency contraceptive, not every day. So if you want to take a contraceptive every day, then it's going to be the daily pill, not the emergency contraceptives. I hope you are good.
Yes.
Okay.
I want to ask, does it have an effect on your womb? Like, is there any effect on giving birth?
Okay, thankfully, most of the contraceptives you find are reversible in nature, and they act on the wombs or somewhere, sometimes not just the womb, or sometimes on your ovaries. That's how come you are not getting pregnant. You remember, it's your reproductive system, so that's where they usually will act. But the good thing is, most of them are reversible. The ones that are not reversible are the sterilization methods. Okay, so with time the hormones will get out of your system and you are back to good. Okay.
What I know about contraceptive is that it prevents you from getting pregnant after having unprotected sex. That is basically what I know about contraceptives.
So that's impressive. You know a little bit about contraceptives. But I'm your pharmacist today. I want you to ask me one question about contraceptives. Any one question at all.
The question I want to ask is, does it have any side effects? You see, we read the outlet that they give to us, but I want to know if truly doesn't have any side effects, as they always see. They always say or whatever. Yes.
Sure, they do. Some do. Depends on the kind of contraceptive that you are using. Basically, you have plenty contraceptives, but the ones that will usually give you the side effects are the hormonal ones. Those are the pills and sometimes the IUDs that contain hormones. Those sometimes will give you a few side effects. I want to ask you one simple question. Do you know any example of contraceptive at all?
Yes, I know about the condom and the IUDs and yeah.
Okay, that's good. That's good. So I want you to ask me one question today. Anything at all about contraceptive.
Okay. Please, which one is the safest?
Okay, so the thing is, every contraceptive I cannot say is perfectly all right for anyone. Okay, so what happens is that sometimes you would have to try them out. If it's not working for you, you change them, and you have to also know how they all work, and you make a choice for yourself. So there's nothing like the ultimate contraceptive. Okay, so there are various types of them. Some are hormonal in nature, some are non-hormonal, some is the barrier method like the condom that you talked about. So you really have to talk to your midwife or your doctor, and they will give you all the choices, and you think about it. They will talk about the side effects, and you make your own choice. I hope you are fine now.
Yes, please.
Thank you so much. I want to ask you one simple question. Can you give me at least 3 examples of contraceptives you know?
Okay, we have that of Lydia, we have that of Secure, we have that of Postno 2. I think that's all I can remember.
That's quite impressive. Okay, so you've answered my question quite well. So I want you to ask me one question.
Oh, okay. When how come if a contraceptive is being introduced into the body, it changes the hormones?
So that happens because the contraceptive that you are actually using itself is a hormone. Okay, so imagine you are putting a foreign hormone into your natural hormone system. What will happen is that it will put it off balance a little bit. That's why sometimes you find some side effects when you use some contraceptives, because the contraceptives that you just mentioned, all of them are hormonal contraceptives, and the 2 that you first mentioned are emergency ones. So that's how come it happens that way. Okay, thank you. When do you think it's right for someone to start thinking about using a contraceptive?
The right time is, I think, dependent on you. For me, I would say when I think I'm sexually active. Yeah, I can be sexually active for a time in a year and go off and on. So as and when I'm sexually active. And secondly, too, if you are married and you don't want to have children, or you want to do your family planning, I think those are the time you need to take your contraceptive.
Okay, that's such a great answer. So I want you to ask me one question, at least one question that you want to know about contraceptives. Anything at all.
Okay, what are the side effects of contraceptives?
Okay, so there are various side effects that might come with some types of contraceptives. Remember, not all contraceptives. We have different kinds of contraceptives. We have the hormonal ones, and we have the barrier ones like the condoms, and we even have the natural methods. So definitely the hormonal ones will sometimes give the ladies some off balance with their menstruation. Sometimes they resolve on their own, sometimes it doesn't. Then you will think about changing your contraceptives. Sometimes too, there is weight gain involved. So those are the few things you can have when you use hormonal contraceptives, but it's not for everyone. You get that? Okay, so thank you.
I have a follow-up question.
You can.
Okay, do you need to go and see your doctor for her or him to prescribe the right one for you, or do you need to just go to the pharmacist for you to say, okay, I'm buying this type of contraceptive?
Okay. That's quite good. Depends on the kind of contraceptives you choose to have. But if you have no idea anything about contraceptives, you definitely have to see your doctor, and your doctor will explain it and you choose. But if you have any idea, a little bit of it, and you think you need a condom, you go for a condom. If you know about emergency contraceptives, you go to the pharmacy, you can get it. But when you want the real hormonal ones and the IUDs, when I talk about the IUDs, I'm talking about the ones that they insert into your cervix, the cervix area. That's when you really need to see a doctor. But when it comes to the condoms and the emergency contraceptives and even some of the pills, you will definitely get them in the pharmacy. You don't need to see a doctor. Are you all right now?
Thank you.
Coffee now or hey, a sharp on to an seal.
Me do me yario, na my renty, mintin piem cotedro.
Oh, coffee, and an hour how home. Uber to me at all, no, you know, what dragnet up no so I won't 209.
Dragnet?
Ah, name dragnet, me, having home be a woo. And one is a macro up no so na much in ram here, you know. And I'm a friend pharmacist, no, na me jimmy, or the no, you know, be bremen, I watch me 5 CDs pet.
And you just where the mammy want to me put that.
Emerson. Also download the Dragnet app free Google Play Store and now App Store nenya ahoto so papa bi. Dragnet app bear for the tombia edi kankra.
We have a question that just came in and it says that please how often can I take emergency contraceptives?
Okay, so with the emergency contraceptives, before you start using them, you should have a fair idea of what your safe dates is going to be. So if you don't know anything about safe periods or during your cycle, you need to really speak to your doctor or your midwife, study your menstrual cycle, find your safe date, and that's when you will need to use an emergency contraceptive. So the maximum you really have to go to in a month is 2, just 2 at a time in a month. That's the maximum you need. And if you are really having sex all the time and you are messing up your safe periods, or it's not even your menses is not that stable, then I think you should go for a long-term method.
Well, there you have it. You can only have 2 in a month.
So today I'm here to give you some few tips about contraceptives, what you need to know when you want to choose a good contraceptive for yourself. So you can ask yourself, how sexually active am I? Do you have sex once in a year, once every 6 months, or you're having sex every day? Then you should be thinking, if you're a female, you should be thinking about a long-term method of contraception. Okay, and if you also have an STD, not all contraception is for you. You should also think about your age. If you are more than 35 years, you shouldn't think about taking the daily combined pills. If you want to know more about that, you can ask your doctor about that. So these are the few tips I can ask you. You should also know that when it comes to the withdrawal method, it's not an ultimate form of contraception. Remember, you give out a little bit of semen even as you start having sex, not even before you ejaculate. So that's also a tip you should be considering. So more on the tips. We are talking about emergency contraceptive now. That's the most popular contraceptives among the female youth. I'm talking about the post pills. You know their names already. So what I'm trying to tell you now is when you want to use the emergency contraceptive, you shouldn't be using it every day. You use it only when you are not safe. So if you are going to stick to the emergency contraceptive, you should know more about your cycle and know your unsafe dates. That's when you will need it. So a maximum of 2 is all you need during the month or during your cycle. So you don't need many. If you do, what you are going to do is you are going to put your whole menstruation off balance, and if you are putting your menstruation on your hormones off balance, you are predisposing yourself to all sorts of diseases and some cancers. So if you want to know more about that, you can talk to your doctor. But note, if you are having more sex, think about having a long-term contraceptive, especially the women. Thank you.
Thank you so much for watching Ask Your Pharmacist. This was proudly brought to you by Dragnet, your #1 online pharmacy, and the Pharmaceutical Society of Ghana, supported by Samus Pharma Limited and ETV Ghana. Always ask your pharmacist about your medications before you take it, because you know what goes in you is irreversible. Be careful of what you take. Ask your pharmacist. Stay safe. I will be coming to your way the same time next week, and I hope you stay safe. See you. My name is Peggy. Bye-bye for now.